Hi everybody, this is Will Hall. Thank you so much for inviting me to this symposium. I especially want to thank the Center for Excellence of Integrative Bioethics. I want to thank my friends at Association Ludruga and my friend Adi and everybody who's there at this wonderful symposium. I very much support your efforts, and I'm really happy to be able to participate in the form of this video greeting. I am diagnosed with schizophrenia. I don't identify with that label or with the concept of psychopathology. I think that the wall between the normal people and the crazy people is an artificial one, and that all of us experience extreme states of consciousness in some form or another, and when some individual exhibits an extreme state of consciousness in a more pronounced or prolonged or expressive way, it really is about the social context and the history of that person and what they've been through that accounts for that experience, not some malfunction or difficulty that resides exclusively inside the individual, because I think fundamentally we can't actually demonstrate that there are individuals. I think that we're fundamentally social creatures. And so I'm very, very glad that this symposium is happening and we're able to explore the concepts of madness and mental illness and psychosis from outside of a strictly reductionist biological framework. Now, there's a lot of different ways that we can look at this question of what is psychosis and what is madness. And I think that's one of the things that's exciting about this seminar, is it's bringing together all these different understandings and different points of view from a psychological lens to try and explore what the meaning might be in psychosis, where it comes from, what purpose it might have, and why it exists, and most importantly, how we can respond in a meaningful way. Now, I think that the validity of diagnosis itself is very much in question, because this wall, as I said, between the normal and the crazy doesn't really exist, and we just have to go back historically to look at why this distinction between the normal and the crazy should be questioned. We should remember that it was only until the 1980s that the American Psychiatric Association included homosexuality in its DSM listing of psychopathologies, that being gay was considered a mental disease. Now, it's important to remember that it wasn't the psychiatrists and psychologists and researchers who explored homosexuality and then realized, well, actually, being gay is found throughout all cultures, throughout all history. It's a variation, a normal variation, a minority variation, but it's a variation of human experience. It's not abnormal. It wasn't the researchers that came up with this. What happened was that there was a political challenge that came from the gay liberation movement. And it was the Stonewall Rebellion, it was political activists, it was human rights activists, it was the social context, it was the society pushing psychiatry to make a change. And that's what resulted in getting homosexuality taken out. And so what I think is needed is to have both a psychological and a scientific perspective, but also a political activist and community organizing perspective, so that we can make the changes that resulted in challenging psychiatry's understanding of gay as a disease. We can make those changes throughout the understanding of psychosis itself, that actually what we call psychosis is normal. What we call the psychopathology of going mad should be seen as a normal human expression of difference and diversity. Now, of course, the first question that comes up when I make that claim is that, well, wait a second, Will, there's a huge amount of suffering that's associated with psychosis. So why is it that you can say it's normal when obviously there's so much suffering and pain, and we want to overcome the suffering and pain? Well, let's think again to the example of homosexuality in the Diagnostic and Statistical Manual. Homosexuality is seen as a psychopathology. Now, researchers looked at gay people in society, and they saw that gay people have higher rates of addiction, they have higher rates of suicidality, they have higher rates of depression, they describe higher rates of anxiety. All the different indicators of suffering and mental distress are higher among gay people. And so you can say, well, obviously being gay isn't normal because there's all these indicators of mental illness. Well, actually, the reason that distress is associated with homosexuality is not because of the difference of being gay. That distress comes from homophobia. The distress does not come from being different. The distress comes from the social response and the internalized response. So what I want to suggest is that all the things that we call psychosis are actually normal, and the difficulty, the suffering that people get into is from the social response and the internal response. That instead of judging someone based on their mental difference, whether they're exhibiting experiences that would be called psychotic, we should really be asking, are they suffering, and how that suffering is related to their experiences of disempowerment. How is their suffering related to their isolation and to their lack of power and control over their lives? Now, I work with many, many people who have bipolar diagnosis, who have schizophrenia diagnosis, who are really struggling and really suffering. And am I trying to get them to no longer have those extreme states? Am I trying to get them to no longer have that different way of thinking, that different way of being in the world, having those altered states of consciousness? Not necessarily. If someone is hearing voices, the only difficulty is if it's contributing to or part of their isolation and their powerlessness. And then I will work with them around these issues of isolation and powerlessness, which may involve accepting and even celebrating those experiences of hearing voices. Now, all the different criteria of psychotic experience, this idea of losing touch with reality, we can go through the list and we can imagine and understand and see historically that there are contexts where those experiences are actually quite normal and quite appropriate. Hearing voices is a clear example of this, because voice hearing, most of the people who hear voices in society don't have distress. They've integrated it as part of their religious experience. It's considered normal. It may be part of them being a poet or an artist. They may hear voices because it's part of their spiritual practice. They may hear a voice as part of their meditation practice. They are living with an experience that for other people would be difficult and causing distress. The difference is not the voice hearing experience itself. The difference is the fact that they don't have a sense of isolation and powerlessness. Suicidal feelings are often celebrated and valued in many different cultures around the world, that many people can become suicidal or even risk or sacrifice their lives or go into states of very deep despair. And this is considered a sign, a showing of a depth of character. In the Victorian era, melancholy. In Japanese culture, the respect for sadness and grieving. Visual differences, visual experiences, seeing visions. Again, artists, spiritual people throughout history have had these kinds of differences. The having strange beliefs, believing that you are being followed or you're being watched or someone is poisoning you. There are whole societies that you can get in touch with and being part of and join a member of on the society, on the internet, whole societies of people who take mind control and UFOs and mass poisoning and different kinds of conspiracy theories seriously. So, of course, when we look at different cultures, and especially indigenous cultures, traditional cultures around the world, behavior, beliefs, the idea that the environment is communicating with you, that it's talking to you, that it's sending messages, that it's following you, that you have a special destiny, going into a messianic states. These are absolutely celebrated and accepted and normal in many, many cultures and different historical epics in the West as well. So really the line that we need to draw is not a line between strange and crazy and normal and more conventional. It's a line around empowerment and isolation. If one person has a psychotic belief, then that person is crazy. If a million people have a psychotic belief, then that is called a culture. So we have different ways of understanding. And what has happened is that psychiatry has taken a cultural set of values and has imposed them to say what is real and is not real in exactly the same way that the church has done this in colonial context, that psychiatry is basically performing a colonial and a colonization function using science to wrap itself in a value-free and a cultural independent and ahistorical claim, but the psychiatry perceptions of what is real and is not real and psychiatric values of what is considered normal and what is not considered normal are very clearly culturally bound and historically specific. Now, there are other reasons that we need to look at psychosis as normal. One of the main ones is, I think this is very interesting, is that there's a whole move in evolutionary biology to ask if psychosis is actually a malfunction and a dysfunction, a breakdown of the system, why does it persist from an evolutionary perspective? Because we know that all traits of a species only are there because they confer some kind of adaptation, some kind of advantage, some kind of fitness advantage for that species. And so psychosis needs to be understood from an evolutionary biology as conferring some kind of advantage to the species. Now, psychosis can be modeled in laboratory animals. You can, just by changing the environmental variables with laboratory animals, with rats, if you subject them to stress, they will exhibit psychotic-like behaviors. If you subject them to certain kinds of neglect, they will exhibit psychotic-like behaviors, which is very instructive for understanding how psychosis appears in humans. Many, many different kinds of stress circumstances will produce psychosis in individuals. Hearing voices is very normal if you're under a situation of grieving, if you are isolated, if people are out backpacking, if they're out in nature, if they're hiking, they can experience a voice talking to them. Sleep deprivation is a huge cause of psychosis. And anyone watching this video, you too can experience hearing voices. Just stop sleeping for 5 days. You'll definitely start hearing voices. You'll be a voice hearer. And in fact, many of the things that we understand as psychotic, if we actually think of them in a different framework, we can see that they're quite normal. How many people have experienced their cell phone ringing and it's not actually ringing, or vibrating in their pocket? They experience it as vibrating. It's not actually vibrating. They think it's ringing. It's not actually ringing. They think it's vibrating. It's not actually vibrating. This is very common. These are hallucinations. So we need to start to think of psychosis as an adaptation, and then think in a response, but not just a passive adaptation, not just a recipient of a cause, but actually a creative adaptation. That the idea of the double bind, someone who is trapped in a situation that they cannot comment on, where they're receiving mutually contradictory injunctions, such as I love you, and at the same time, I'm not going to listen to you, I'm going to dismiss your experience. Someone will use that double bind as the impetus for a creative response of leaving this reality, going into a psychotic state, because there may be resources and solutions in that psychotic state, including disrupting the normative role structure of that social context that produced the double bind to begin with. So I think we need to see psychosis as a creative response, and then the question becomes, what is it that gives rise to this response? What led to this creativity, and how can the creativity lead to a way forward? Not to necessarily overcome and change and get rid of, but to create a different context, a context characterized by empowerment and social connection. Isolation and disempowerment really are the issues that we're facing. And so I'm absolutely thrilled to be part of this seminar. I think it's wonderful that there are people with lived experience. We need to learn from each other and learn from people who've been through it what works for them to come up with pragmatic solutions from a psychological framework and a social framework. Pragmatic responses socially, pragmatic responses therapeutically, that help and work for the individual as an individual. Thank you very much. It's really been wonderful having this opportunity to talk with you, and I wish you a wonderful seminar.